Good evening, everyone, once again, and welcome to the Clinical Physio Series orientation session. Myself, Adam, and I'll be hosting and moderating today's session. Thank you all for taking time to be here. This short orientation is to help you understand how CPS works, what to expect from the series, and how to make the best use of the resources we are providing. So before we move ahead, I just want to set the tone for the CPS. This is a safe learning space, and please ask questions or share your doubts and feel free to think aloud. There is no right or wrong questions here. It's only a journey of learning. Let me handle the mic to Dr. Yaman, who will explain the rules and regulation of the CPS. These are simple guidelines just to keep the session smooth and respectful for everyone. Over to you, Yaman.
Thank you so much, Dr. Adam, for your introduction session. And I'm really happy that I am able to see a lot of people who I know personally and have joined previously as well. Thank you so much for joining once again. And all the new members, welcome to PhysioTags. And we hope this series will be something fruitful for you in your clinical practice. Without wasting much time, because we'll have a lot of time in this session to talk and to share ideas, etc. So let's directly dive to the presentation that is regarding our rules and regulations for this webinar series. So coming to the first slide, we have designed this series to be of 7 nights. Initially, we had a plan to do it for 5 days, and then we extended the days for 7 nights. And we have multiple speakers for this. So the best thing about this series is you'll not get a perspective of a single therapist, but there will be 7 people who will guide you regarding this assessment, how to do, what things to take care, etc., etc. And if you have seen the brochure which we have shared, you might have noticed that the session is not just lecture, it is having multiple formats. So that's what makes our series more special and unique. And whatever we are going to teach is as per the global standard and what is happening recently in the field of practice or clinical. So this is what makes our series more unique and better for you to understand. And all these things we have tested in mkhs, which we had started last year, and we have completed 12 sessions of mkh till now, and we tested many of the learning method and we took your feedback, and then finally we are with a series which is paid and which is premium. We are teaching you how to do the assessment. That is the initial skill which every practitioner needs to have understand. It is not a formality as we have advertised, and about that we'll be speaking further more. Okay, and whatever is your goal with what you have joined with us and what you're thinking of achieving from this series, you can open up tonight and you can speak up, and we'll take care of your expectation. If it is possible to be and feasible to be implemented, definitely our team will try. And this is what other people who have already joined our series in past know, that we take the feedback of students and try to implement it, whether it is offline series or whether it is an online series. So this is what it's your objective, and we promise if it is possible. Definitely not everything is possible, but whatever is possible we'll definitely try to implement that. Okay, and what we are expecting is from this series, during the classes you are supposed to keep your mics muted. Okay, and then you have to keep your cameras switched off, because it will help us run the meeting smooth. And also that the video recordings will happen, and as many of you have requested for the recorded sessions, we have come up with the provision this time for recording the sessions, and the sessions will be recorded and that will be sent to you. About that I'll describe later. And the third thing is you have to engage in chat. There is chat available now. Here we have this is a premium Google Meet, so we have a lot of other options which you might not have seen earlier. The students who have joined in past, I'm telling you, there are multiple options. We'll introduce you to that as well. And we are asking you to be very punctual with the timing. So tonight we have started meeting 5 minutes or 7 minutes late. So that will not be the case during the sessions. If you miss the session from the minute one, then it is your loss. So that is the reason you have to be very punctual, because the meeting will start at the destined time without waiting for anybody. So during sessions we are not waiting for anyone. Today we waited because it is an orientation session and everyone needs to be aware of the rules, what is going to happen. Okay, so finally we have four specializations that we are going to deal in this series that you have already seen in the brochure, that is musculoskeletal science, neuroscience, cardiopulmonary science, and then pediatrics. For this time, four major fields of physiotherapy will be covered. As I have told you, we are combining multiple formats to create a learning environment that is dynamic as a real world clinic. Our sessions are comprised of various modes. So there will be lecture, there will be quizzes, there will be micro talk, there will be panel discussion, there will be podcast, there will be role plays as well. So if we go through the brochure which we have shared, that is session one is having podcast, and then there will be a role play. Then after the initial session ends, there will be a break will be for 5 minutes for you to relax. Break is necessary because even the speaker needs break. So after that there will be an interactive quiz, so which will be dealt by me. Okay, generally I'll be there and I'll be doing quiz for 5 questions which will be covered in that particular session. So once we finished with that session, we'll have expert panel discussion every session. This is the story. So expert panel discussion will happen where multiple admins are speaking, and we know that even from audience we can get lot of beneficial input. So we are expecting the audience to speak up in this particular time. So it will be somewhat 10 to 15 minutes that will happen. So we are expecting the audience to speak up in this particular session, and you can ask questions or you can share your clinical experiences, because as I see here, all the audience who have joined are at least of 4th years and practitioner level. So definitely you might have seen the patient, you might have observed something that you can share with us, because it is nothing that those who are speakers are going to teach, and learners cannot teach. Learners can also teach, and teachers are also learners. So we are like your friends. Please understand that we are very what you say strict in terms of explaining or whatever, dealing the things and all. Please consider as your friends. Let's make the environment very friendly. Let's think that it is a fun learning process. Okay, with that we'll be conducting the sessions, and you might have noticed at the end of each session you have one surprise talk, and speaker, he's none other than me, because last time we have did like many of you are aware of that. So every session at the end I'll come and I'll deal with something very surprising. So last time it was dealing with psychological aspect, personality development traits, or whether it is something related to a funny joke that happened in clinic. So something very interesting, or few advices that is very important for you to develop professionally, that was being covered. This time you are also trying to do the same, but yes, there are many surprises. So surprises are better if those are kept as surprises. So this is how the session will continue. Okay, the second session, it's about pediatrics. Again, 2 lecture sessions will be there. We have divided into two components. So the first one is history component, and then second one is observation, examination, and investigation part. So this will be done in the form of lecture, and then podcast will happen. Podcast is nothing but two speakers are speaking with each other. They are explaining to the audience as well as they are sharing each other's thought. So it is not a boring lecture kind of thing, but it is an interactive session where two speakers, two people who have experience in that particular field, are sharing their real life statements or whatever it could be. So this is how the second session will go. Third session is again musculoskeletal. That is very important field in the physiotherapy. So again, we have two components, two lecture. After that, we'll give a break. Again, interactive quiz will be there, expert panel discussion, and again a surprise talk. That will keep it as surprise. Again, session 4 will be of neurological examination. There will be again 2 lectures, one break, one quiz, then expert panel discussion. We are expecting all of you to join here and discuss whatever we can discuss. You can teach us as well, not a problem. We'll teach you, you teach us. Let's learn. Learning is very important, and rest everything is just a formality. Being here or being there is just a formality. Learning is the purpose, so that needs to be taken care. Okay, session 5 will be cardiopulmonary examination, where again we have this time we have kept for observation, auscultation, palpation essentials, we have kept it as podcast. Then we have examination investigation as a lecture, and then again one break will be there. Then we have quiz, then we have expert panel discussion. Again, we expect you to ask some questions regarding that particular session's doubts, whichever you have. Okay, and then surprise talk again it will be there. Session 6 will be of problem list and ICF diagnosis. Very important to understand, because a lot of interns which we happen to see are unaware of how to assign codes for a particular problem and how to set our goal and what is the basic purpose of the problem list or setting goal. We are unaware of it. So in this particular session we are giving you the standardized ideology, what you should keep in your mind by while you are setting your goals by specifying your problem list. So that will be again multiple people will be there, 4 people will come and 4 people will discuss as a panel discussion. We are talking with each other, we are explaining you, we are taking your questions, break will be there, quiz will happen, and then the expert panel discussion where we are giving chance for you to speak. And then again at the end surprise talk will be there, and the last session is about goal setting and treatment planning. So this will happen again. There are podcasts in this, we'll have a break, then a quiz, and then we have a final discussion with the admins, and then I'll be closing the series with the like advices I'll be giving you, and then we'll be closing. Okay, so let's come to the other thing, associated thing, which is there with this particular series. So to gain certificates, I hope everyone is listening, please raise your hands guys. Yes, so this is very important. Many of you have promised that you will be attending this series if you are provided recorded lectures. But what if all 85 people are telling, no, we are happy with recorded lectures, we don't want to attend live? So if you do that, we have kept one nice gift for you, that you will not be given a certificate. That is your gift. If you are failing to attend at least 5 out of 7 sessions, then you will not be given certificate. If your attendance is there for 5 or more sessions, then you will be given a certificate. I hope I am being very clear from the beginning, because we want live audience, we want live interaction. Active learning is very important. Passive, again, YouTube videos is also there, there is no difference. So please try to be like attending the sessions live, and if you cross 5 days or more, only then you will be provided certificate. And that is all. Recorded lectures, again, we are doing a premium Telegram channel where everything in a systematic way will be shared. So for example, session 1 will be putting session 1. Many of you are aware we have premium recorded lectures for neurological approaches, and then recently I have made on research as well. So we have made it very systematically. Same thing will happen here as well. Session 1 heading, the recorded lecture of 1.5 hours will be there, where the live recorded lectures will be there, and at the end of it, whatever resources are necessary for that particular session will be posted one by one in a systematic way. So at the end of 7 sessions, you will have a proper systematic group with lot of abundant resources in a systematic way after every session's video, and it will be very beneficial for you. I am telling from neuro part, I am adding 40 scales PDF that can be filled by it is like a empty scale which can be filled in clinical postings. So you just have to take a printout and go and fill it. So like that, I am providing 46 scale. Okay, I have already made a resources already. We all have made the resources ready, and we will be providing you lot of resources. Along with that, what is very important for you to understand here is we are providing you the blank assessment forms for all the specializations. Apart from that, we are giving you a sample assessment form for all the specialization. What is blank? Blank means you just have headings what assessment you need to take under a particular subheading. And what is sample assessment? It is an already filled assessment by your senior or some person who is an expert in that particular field. So by that, you'll be able to understand, okay, this particular thing should be reported like this. So you'll get an example for you to practice. You'll get an example for you to implement those reporting skills in your practice. So that will be happening. And apart from that, we will not be sharing the lecture PPTs. So that straight away, I'm telling all my team members also, we are not providing lecture PPTs, because video is there and PPT is there in that particular video. So but whatever we are explaining in terms of the PPT will be transcribed into the Word document, and that document in detail will be shared again. So all things will be at one place, that is in Telegram group, that we will form after 2 to 3 weeks of the the series completion, because we need time to organize things, because we are recording and we are adding there. So those things we'll do, and we'll provide you the resources as how the time passes. Okay, so this is all about that. First session will be on Jan 12th, second on 13th, third on 16th, fourth on 19th, fifth on 20th, sixth on 22nd, and seventh on 27th. So you need to be very serious about these dates. Kindly give priority to this, because if you have invested in something, like, utilize it to the fullest. So we are requesting you to make the best use of this series, and I hope I hope this particular series will be very beneficial for you to improve your skills and be a good practitioner.
And I'd like to hand over this part to Dr. Lazima for our chit chat session. Over to you, Dr. Lazima.
Thank you so much, Dr. Adam. You have handled it so nice. You've set the pace so amazingly so that we all could release our little bit of stress. Thank you so much to you as well. So I want all of my audience, the 79 ones who have joined, I want all of them to interact with us. And then let's keep all the formal things aside, and let's release a little bit of stress that you're holding.
Hello, good evening. Can you hear me?
Yes.
Hi, good evening, Syed.
Good
How are
evening.
you doing?
I'm pretty good. Fine. How about yourself?
Yeah, I'm doing great. Having a very good time with our
I'm
participants.
really so appreciative for the team PhysioTags. I really
Thank you
hope
so
that I
much.
can not get that I can live up to your expectations towards the future and use your reference in terms of that. One of my times while I was studying, I could say that PhysioTags was one of the reasons that my knowledge can get enhanced, and hopefully I can use this for clinical experiences towards my patients in the future. One of the questions that I wanted to ask regarding the clinical series is that, are we covering up sports science in any way?
Uh, as such, we do not have included sports science, but definitely, like, since you've asked, we can work on the very necessary things or the special areas where you have to concentrate on. That can be added as a comment. Is it possible? No, isn't it?
Yeah, 100%. Not everything can be covered in 7 days. That is the reason we are making the provision of the panel discussion after the session for 15 minutes, where questions from audience can be taken, or whatever is vital that has been missed can be recovered there. So it is a well decided and planned, the framework is done in the way that it helps, it maximizes learning. So we try our best to cover, and for this particular thing I request Dr. Taha to take care of this thing and come up with some points which covers up the sports sciences as well. Yeah.
Thank
Next
you so
question.
much. Thank you so much, Mr. PhysioTags and the team PhysioTags, sir.
Most welcome. Most welcome.
Right. Thank you so much for putting it up so that we knew that you wanted something like this.
I think one question was there in chat box. Assessment provided should be in an editable format so that it can be easily handled digitally. Of course, it will be Word document which you can edit. So any more questions like this from you people is more than welcome, because we have just 8 minutes left. So kindly guys, come on, speak up. At least raise your hands. One who is watching this meet and not using Instagram. There is, yes, how many? 1, 2, 3, 24, 27. That means
Wow.
you people are 30 out of 60. It's still less than 50%. Not all audience are here, I guess. Come on. 32, 31. So I'll ask you, are you listening? Say yes, sir, all at once. Unmute. Break that barrier. Don't be scared.
Yes, sir.
Yes, sir.
Yes,
Good,
sir.
good,
Yes, sir.
Yes, sir.
Yes, sir.
good,
Yes, sir.
Yeah.
Yes,
very good,
sir.
Yes, sir.
good,
Yes, sir.
good.
Yes, sir.
Very tired, yes, sir, I think.
They're all preparing themselves for the show that is going to come up.
Excuse me, Dr. Lasimo.
Yes, yes.
My name is Ricky Kashija. I'm a physiotherapist in Uganda.
Hello,
I just wanted to say,
welcome,
hey,
welcome on
I
board.
wanted- thank you. I just wanted to make perhaps a reminder or make a request that because
Sure.
of the changes in time zones, perhaps we would get reminders about the meeting so that we don't miss them. We could have it on schedule, but still, because of changes in time zone, we might end up missing out on the lectures. So if we get those reminders, especially in the WhatsApp group, that would be really, really helpful.
Really, definitely, we'll be giving reminders through your registered mail IDs as well as through the WhatsApp group where you have joined in the CPS group. So please do have a check on it. Even if you miss your mail, it's fine, but you will definitely have it in your WhatsApp group.
All right.
Before
Thank you so much.
we end the meeting, we have two more questions in the chat box, I guess. Kirtana H, third year, says that she's very excited to know more
Hello,
here. And
Kirtana. We are also excited to have you.
then David again is asking, will you be sharing more materials like books for further learning in areas such as pediatrics? Yes, of course. We will be sharing a lot of resources and definitely it will be worth.
We have got a question here, and also a
Yes.
person who has raised the hand.
Yes.
So, a quick question: do we need to do a prior quick study on specific topics before clinical series session to have a better understanding?
I think you can do that. There is not a problem, and we'll leave this to the session in charges so they can decide what they are planning. So
Yes.
if it is an ortho related session, they will decide whether to read on something and come. Will like facilitate learning during that particular session.
It's always better to be prepared, be well equipped before coming into the classroom, isn't it?
Yeah, maybe we
If
can say ICF ICF topic is gonna happen, so we may request that for that particular ICF topic, you might refer some resources and come like that.
and if needed, we may also give you some of the things like the study materials, which you can just study and come before the session.
Thank you so much for joining this, and I'm really very happy that all those PhysioTags Gold members who have joined, thank you so much for trusting us, and all those other people who are not aware of how we work and what we are doing, still you have shown the trust. It means a lot to us, and we hope that we are able to fulfill all your expectations, and this becomes a historic series in the field of physiotherapy. Come prepared, guys. We are gonna have blast.